It's great to see you again. So you've just passed your SCA exam and you've kindly agreed to tell us how it went and what you found helpful when you were preparing for it so we can pass these tips on to others. Do you want to introduce yourself and tell us a little bit about yourself?
Thank you. My name is Daanyaal. I'm a ST3 now, based in Waltham Forest. I first heard about Clinitalk through my trainer, actually, Dr. Lodi, and he said that he's just heard about this app that can be used to record consultations and give feedback.
So it was through your trainers and educators that you heard about it. And then so how did you actually get onto using it then?
So the app itself is quite easily built, I think. So what I did in my clinic room was like, well, obviously you get the consent from the patient, you'd have everything written, there's nice leaflets on the website that you can actually print and give to patients, and at least they're aware of what's going on. So I'd give that to patients. I'd also tell them a bit before I start recording, and then on the web browser I'd connect the sort of just the microphone or the headset that I use to kind of do my telephone consultations, press record, and then everything worked fine. And then I wouldn't look at it there and then, but I'd wait for them to go out and then look at it in the evening, perhaps.
And how accepting were patients about you recording? Was that okay?
I never had a no.
Okay.
Everything I did, everyone said that they were happy for me to record, and I honestly found a lot of benefit in it.
Yeah. So why did you find it beneficial? How did it help?
This year, personally, I had a lot of setbacks. So I had things going on at work. I've had things going on in my personal life. And then I don't know if you must be aware, but I had a newborn baby in about October. So I was not sleeping at all. And I think just having Clinitalk there meant it so that even though I couldn't get onto regular sessions with my other buddies that I was practicing with, at least I had someone in the room with me virtually, or an AI assistant that could sort of record the consultation and guide me. And even my trainer, when we used it for a few case-based discussions on 14 fish, he was quite impressed by the feedback that was given from it and how everything's nicely structured. So I think definitely being a busy dad, a lot of personal setbacks, a lot of like health issues this year, it's definitely helped me a lot. With gems that you guys post on the group every week, a lot of people do read it, and it does get circulated around to other GP registrars, and they do see it and they do learn from it as well. So the WhatsApp group, different trainers such as yourself, Professor Khan, and Nikki, and everyone else over at the team, my own trainer, the practice staff, where they would throw me different patients to kind of make my life a bit more complex, and my training buddy as well, or my practice buddy, they all helped me pass the exam.
So I'm really sorry to hear about the health issues. I'm really happy to hear about your new baby. So it has affected your sleep. But great news that you passed your SCA. You said that when you were using the app, you would kind of record in the daytime. You wouldn't really look at the feedback then. You'd go back and look at it later in the day. Is that how you'd recommend using it to others?
I do recommend that people do record a day's worth and then look at it in the evening, because you often see in certain similar threads. So for me, for instance, I was really bad at safety netting and discussing different modes of treatment. I also found that in the last portion of the consultation, where it gets to the manager point, I was doing majority talking, wherein the patient had no input. So it often flagged me up on those points.
So it helped you to recognize that you're missing out on some key areas, the safety netting advice, and not being too verbose, too overbearing in the management part. I think that's such a common thing when you start out, trying to bring that management earlier in the consultation so that you've got time to have a discussion rather than just telling them what to do, particularly if you've been cut down to 15-minute appointments, you don't have breaks, and you've got the pressure of thinking, I need to get on to the next patient. Yeah. How often were you recording in the week?
What worked for me was to do it a few times a week. I wouldn't use it for every consultation. So the practice that I'm based at is phone in at 8 o'clock in the morning and get an appointment. Because a lot of things would either be cough or anything vague or viral illness. For those ones, I wouldn't quite record as much. And that's because for the SCA, what they're looking for, at least from what I saw, is your ability to manage and ability to handle the, uncertainty. So simple consultation where I thought was viral, and I saw in the booking notes viral illness, I wouldn't use it. But anything slightly more complex, example, any blood in the stools, any pain in passing urine, or any ones where it said private problem, then I'd use to record it then. And then it worked quite well.
Okay, so you're selective at trying to find those consultations which are more SCA-like. Yeah, and I think that's very sensible use of your time.
What I did personally was that I went through each point at a time. So if I knew that my safety netting was rubbish, I'd focus on my safety netting for the next week. And if I thought I wasn't given a well-rounded management plan, then for the following week, I'd focus on that. And slowly, I saw all the ambers move on to greens. And then now it's mostly like greens and like a few yellows, which I still miss out. But I'm still using it now.
That's amazing. So I think that's a really good way of doing it, focusing on one area. I think that's a really good tip to people, because often we do get people say, well, I've got a few areas that I need to improve, and then they try to work on all of the different areas, say 5 things simultaneously, and it's hard to do the improvement across the board, and it's probably a good idea to focus on one thing, and a week sounds like a really good time period for you. Did you use it with friends at all to do any role plays, or did you just do it on live consultations?
So funny enough, as we approach the exam season for the SCA, I asked my trainer if he could watch us do a consultation, me and another GP registrar, and record it at the same time. So although he'd give, and then what the funny part would be with that, I'd give the feedback on the Clinitalk app, and he would say, yes, I completely agree with all of that. Yeah, because it was good feedback. Having the app, especially when you don't have training buddies or any buddies that you prepare with, is very, very good. Very good.
Well, it's really pleasing to hear that you had a really good alignment between what you thought, what the examiner, well, the examiners obviously agreed because they passed you, but the trainer and your Clinitalk agreed largely. I mean, it's by no means there to replace the trainer. It's there to kind of back up what the trainer's saying and to help trainers and yourself find what are perhaps the more problematic areas, so that you can work on them and then discuss them with your trainer and have some evidence for your COTS or whatever. Did you use it for COTS or CBDs, case discussions?
Definitely, yeah. We did. And we used it for twofold. Number one is that the recording is shared with the trainer, and that's something that all the patients know about. So your trainers can listen to your consultation style and see if you've used or said anything, or see how your management plan has come across, and then use it to help you. And the second way that you can use it is that there's often a nice summary, there's nice learning points. There's another thing called the patient lens. That's where you give your own perspective, or the AI tool gives their own perspective on how you made the patient feel, or what their own gist or their take home was. And using all those things together were quite beneficial for us doing a COT.
The patient lens, as you say, it tries to give the perspective of a patient giving feedback. You know, what would they say? And we went to a patient group to ask them, a patient participation group to ask them, you know, if you didn't have to have an appointment with this doctor again and it didn't harm your doctor-patient relationship and you were honest about what you really wanted to tell them, what would you say? Because there is that thing of patient feedback. They know that they want to have a relationship with you. They don't want to upset you. And some people also aren't able to give very good feedback, perhaps because they have cognitive impairment. And so I think this is a good supplement to the standard patient response to give, to get some honest, unbiased feedback points. Yeah. So that's good. So is there anything else that we haven't talked about that you want to give advice to other people?
I think in the SCA, it comes with a blurb, and it's important that you read the blurb and read the blurb, because there's nothing trying to trick you out in that blurb. If a patient's booked an appointment to book some concerns, they've booked an appointment to discuss some concerns. If there's blood tests and they want to discuss their results, they want to discuss their results. I'd say get to the crux of the issue as soon as possible with the SCA examination. Have 1 or 2 good study buddies that you can use, especially if you're busy working dad. You need someone that's flexible to work around you so that you can train. And my training buddy was absolutely great, by the way. His name is Jason. And important for you to pace yourself, because it is a tough day. It is a tough day. It is a tough clinic.
Had you done 12 consultations back to back, or at least 6 back? Because it's 6 back to back, then it's a break, isn't it, in the middle, and you have another 6. Had you had experience doing that beforehand?
Yes. So my trainer, I don't know whether he likes me or hates me, but he gave me but since about 3-4 months before the exam, he gave me a 12 clinic patient, 12 patients in the morning clinic, 12 patients in the afternoon clinic. And I didn't like him at the start because it's a lot of work, especially getting used to it. But now that I look back at it, I think that he was he's an absolute amazing trainer. He actually looked after me. And the reason why he pushed me to have 12 in 3 hours and manage complex cases was because it was getting me ready for the SCA. And as cliche as it sounds, and I know everyone says this, that's past the exam, use your patients in real life to help you prepare and practice for the SCA.
Okay, that's really good advice. I think that real life patients are as real as it gets. We have simulations because you can't get the real life patients. Real life patients are really important, aren't they? And it's great to hear that praise for your trainer. I'm sure that they, whether it's a he or a she, I don't know, would be delighted to hear your praise for them. Yeah, well done, and thank you very much. It's great to speak to you, Daanyaal.
Thank you. Bye-bye.